Okay, so today we're going to be talking about my case presentation patient. My patient was a 40-year-old Hispanic female. She had a negative medical history, no allergies, no medications. Her vitals were all within normal limits. Her blood pressure was 134/86. Her temperature was 98.2. Her pulse was 64 and her respirations were 14. I did classify her as an ASA class 1. And when I spoke to her about her dental history, she said that she did not know the last time she had visited the dentist or had a cleaning. And she came in to get a cleaning. When I did the intraoral, extraoral exam, she did have a mole on the left side of her face. Intraoral, she did have her tonsils. As far as her gingival assessment, it was generalized erythematous. She had localized melanin around her maxillary facials. Generalized blunted papilla throughout, as well with rolled margins. She did have localized stippling in the maxillary facial, and her consistency was generalized fibrotic. Her caries risk assessment, she did have a bunch of exposed root surfaces as well as a retained root tip. So I classified her as a high caries risk. Also, after reviewing nutrition with her, I decided that she was definitely a higher caries risk. Calculus detection, I classified her as a calculus class 3, and I chose to chart number 13, 14, and 15. Her occlusion, the right side she was a class 1, the left side she was a class 2. She did have an edge-to-edge bite in the anterior and 1 millimeter overjet. For her PSR probing, sextant 1, you can see I got a 3, sextant 2 was a 2, sextant 3 was a 3, 4 was a 3 with an asterisk. The asterisk was due to recession. The whole mandible did have recession on it. Sextant 5 was a 2, and sextant 6 was a 3, and I did later chart the recession. This is her dental charting. So after asking her if she had went to the dentist before, she said she didn't know. This was a good way for me to know that she's clearly has been to the dentist due to restorations. I don't know if that was as a child and she just doesn't remember. But she did have some molars missing, a premolar missing, and some restorative work had been done. And her perio charting, her probing depths actually were not as bad as I thought they were going to be the first time I looked. There were some 4s and some 3s, but other than that, those were the deepest pockets. And we did do a definitive probe of her whole mouth every visit. Some intraoral photos, so you can see here down on the lower anterior, some calculus that was forming. Here, this is the retained root tip. You can see that she did have pretty bad staining. And then on the maxillary as well, you can see her papillas are just, it's very bulbous, and she has calculus present. And these were her bite wings that I took. You can see here, this is that retained root tip. So I talked to her about possibly getting that out and some complications that keeping it, some things that could happen. You can see here just the ledges and the pieces of calculus that are seen on the radiograph, meaning they've been there a while. And then just the bone loss in some areas that were present. And her pan, same thing. You can see, the calculus thorns that are radiographically seen, as well as the retained root tip. And these were her after photos. I was really pleased with them. She was as well. I think the stain was her main concern, just having whiter teeth, and I spoke to her about cleaning everything up, maintaining a healthy state in her periodontium, and then possibly tackling whitening down the road. But yeah, the after, you can see her papilla are way less swollen. They're coral pink. The staining's gone. The calculus is gone. She was very pleased with the outcome. And my diagnosis, patient presented with generalized gingivitis with moderate stain throughout, moderate bleeding, and generalized calculus. She also presented with exposed root surface on the mandible. My treatment plan was to do plaque score. I did oral hygiene on brushing and flossing. We did perio probing, and I did a pan and bite wings on her. I did the dietary counseling, intraoral photos. We scaled the full mouth, and we did air polishing due to the amount of stain she did have. I did apply fluoride varnish, and I recommended that she stays on a 3-month recall. And some treatment goals, to establish a healthy gingiva by removing the calculus that was present, to halt the stage of periodontal disease and prevent further progression, decrease the risk of decay and root caries, educate my patient on dietary needs and create an at-home routine for her oral cavity, and to decrease dental fear and anxiety and promote trust and interest in her dental care. Nutrition recommendations. So after filling out the daily food log with her, she didn't eat a lot of protein at all. She drinks coffee every morning, so I kind of talked to her about how that could contribute to the stain. And she sounded like she ate a lot of citrus fruits mostly. And I did tell her, fruit is healthy for us, but the acid can harm our teeth. If you do have the fruit, you want to swish with water just to neutralize the tooth surface. Spoke to her about drinking more water, specifically tap water for that fluoride, just to reduce the risk of her getting root caries since she does have the recession present. So this is just walking you through what we did each appointment. The first visit, we did the patient assessment, but the patient did have to leave early. Second visit, we did a plaque score, we did the pan and bite wings, and I scaled quad 1, and then perio probed quad 1 and did OHI. Third visit, we did plaque score, it was 50%. I reassessed the probing and the scaling from the previous visit. We did intraoral photos and the nutrition analysis on her third visit. Then I moved down to quad 4. We scaled and probed that, and then we polished. Her fourth visit, so her plaque score went from 50% to 29%, so you can definitely see either she took the information I had to give her and really took it to heart, and was practicing and doing really well with the plaque score. I reassessed what I previously probed and scaled, and then I scaled 2 and 3 on that visit, as well as probed it. We polished, and we did fluoride. So I completely finished her by the 4th visit. Her 5th visit was a reevaluation. That was, I had her come back 6 weeks later. Her plaque score 6 weeks later was 21%, so that was still really, really good. I did OHI on brushing. I did recommend Parodontax toothpaste for her to use, and got her to show me how she's brushing at home to see if she was still doing the right methods that I taught her. I spoke with the patient's husband. He came as a translator just regarding that she stays on a 3 to 4 month recall. And then we just scaled and probed the full mouth and polished. And these are just some instruments I used during her treatment. I used the ultrasonic scaler a lot. We did the periodontal probing. I used my sickles and my curettes. And then these are just my patient's notes and my reflection. So after completing this patient, it truly showed me how many factors can affect the oral cavity and showed me how important patient ed is to our patients. I was grateful to meet my patient and be able to make a huge impact on her life. I felt like she wasn't someone who just needed a cleaning. She actually genuinely wanted to learn and I could tell she'd never been educated on the proper things to do as far as the oral cavity. This experience helped me as a clinician become more confident with scaling. It also gave me more experience treating patients with periodontal disease. Overall, my patient was very pleased with the experience. She was very excited to see the outcome and was eager to learn new things about the oral cavity that she had never been taught again. Thanks for